Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. Welcome to Healthy Desert, Healthy You. I have a very special guest with me today. It is our new board president with the Desert Healthcare District and Foundation, Kimberly Barraza. Welcome, Kimberly.
Hi, Will. Thank you for having me.
Thank you for being here. I've been wanting to get as many of the directors on the podcast as possible, so I'm really thankful that you agreed to be on. So I want to give a little bit of your history with the district. You were elected to your first four-year term in November 2022. And the past 2 years, you've actually served as the board secretary. And then in December 2025, you were elected president. So I know it's very early, so I'm wondering how being president feels different from being a board secretary or being a board director.
Just like you said, it's very early. It's been 3 days, half of a meeting in 3 days. I mean, doesn't feel very different. I'm sure that once we start, getting into the role a little bit more, I might feel it. I have heard from past presidents that it is a lot of work, but I'm ready for it. I really am. I think for me, there's not much of a difference. I mean, when it comes to the actual make of the board, you, as a president, you don't have any like extra power or vote. But how I see it is being able to lead, right, the board. I would like to serve as, I'm not necessarily going to call myself the liaison, but you're like the bridge connecting CEO, our board. And I want to lead in a way where all of our voices feel heard, respected. We all represent areas from throughout the Coachella Valley. So it is very important that their voices are uplifted as well. So I do want to create, not that we don't have that now, but develop it even more where, hey, like we're all here to bring our voices, our perspectives, and so to be respectful and just develop and make ourselves an even stronger board.
That's wonderful. And you mentioned the different zones, and you are representative of Zone 6. Talk a little bit about how long you've lived there and just your overall impression of that zone.
So I grew up in the Imperial County. I lived there till I was 18. I actually got to live here in the Coachella Valley a couple of times earlier during my childhood with my parents. And so after graduating high school, I decided to move to the Coachella Valley. So I've been here for most of my life now. And so I've always lived in what's actually now Zone 6. It's parts of Coachella and Indio. And I think I've always lived within the boundaries of the zone. And so for me, it's just very important that, I was elected to represent the needs of the constituencies within this zone. And so having pretty much lived here all my adult life, being able to see the progress and the needs here in the community, I think it's just of great value.
Absolutely. One of the things I know about the zone, at least what I hear anecdotally, is that most of the growth in the Coachella Valley is actually taking place in Indio and Coachella. So that must be very exciting for you.
It really is, especially when you look at, like, let's just, mention their downtowns, especially downtown Indio, where I'd go to church and I'm so familiar with the area. And then also living just a couple of blocks away from it, being able to see, like, I'm seeing the development, the different aspects, the educational aspect, the business, local, and just building community within the downtown. Since I live here, I get to see it daily. So it's kind of like in slow motion. And like you start seeing, like, especially the buildings where you drive by there every day and it's like in slow motion. You see how it's being built. So that's very, I guess, to some extent gratifying. I'm a little, in Spanish, we call it cursi. I'm a little like cheesy with these things, but I think, yeah, I really am. Or maybe I just romanticize it too much where like I'll take my kids walking to downtown, right? And just walk around. And I think that's what it's being built for. And the same with Coachella. I moved here to the Coachella Valley was 2006, and just seeing all the growth within the last almost 20 years, it's just amazing to see. And then also knowing that we are part of it in some aspects. So yeah, it's really good to see.
Yeah, it's very exciting. I want to talk a little bit about your professional experience because being on the board is not your first foray into public service. I know that you worked for a long time with Assemblymember Eduardo Garcia. Can you talk a little bit about when you first realized you wanted to be a public servant?
Of course. I think that public service has kind of like always been in me or an interest. I remember growing up in El Centro, California, driving through the library, or all of a sudden there's a new store in town. And so I remember asking myself, like, who makes these decisions? Like, does anybody know that they're coming before they're coming? Right. And there was always an interest within government throughout school as well. Derailed, got a degree in business, and then an opportunity came about to intern at a state senator's office. And so that's what like reminded me, right? I was like, well, now I'm going to get these questions answered, right? From many years ago and actually get to know what local government is about. My intern there, so that was a state legislature. And then I interned with the city of Coachella. And so that really did open my eyes on how important, right, these roles and positions are to serving the community of customers or residents of within a local agency area. And so I think those two experiences really did bring me back into like public service. Serving on the board with the Desert Healthcare District, it's my first time that I was elected. I actually did not think, or it was not in my plans to run for office. But then, yeah, like again, after working for the state assembly under Assemblymember Eduardo Garcia's office and realizing the importance of public service or being elected and just the fact that you are able to make decisions on behalf of, the residents that you represent and actually make a difference within our community. As you mentioned, like policy, right? I love policy and just like the creativity and what you're able to do within policy. And so the opportunity came to run for the healthcare district. And I said, why not? Let's bring that experience. And I think the way of like how I think within work or within that space. And so now let's translate it onto me sitting on the dais with, others, with 6 other board members.
Right. You certainly bring a very unique experience when we think about your time involved around the legislature. You recently started, I think it was your idea, but correct me if I'm wrong, the Legislative Policy Committee for the district.
Mm-hmm.
What is your vision for that committee?
So my vision for that committee is creating a little like arm or a voice within the healthcare district to support, sponsor, create legislation. We're a powerful district, and so are many other special districts throughout the state. Falling under state government, I think it's important for us to follow that because the state could say something and not that we wouldn't hear or get a letter about it. But I think that if we position ourselves in a place where, hey, there's something coming through the state legislature and we actually have a stance or that's going to affect our region, I think that makes us more powerful. Second to that is also building a relationship with our local legislators' offices, right? I think that only makes us stronger as a region. And I can think of, collaborating or partnerships with other special districts or municipalities where we can actually go up to Sacramento and so at the federal level, but specifically Sacramento, which is where I've worked, and are at, I would say it just makes us stronger. And me being on the other side, right, knowing when we would welcome advocates, we would always look for that. Do you have the support from your special districts, your cities, right, partners within the community? So we did not have a legislative policy committee. I did think about it, and I think it's been going good. We've invited, like I mentioned, our local representatives. We've had good conversations. We're thinking of ideas for policies or bills for the next year. And then also, we're ready to support it. Just like I mentioned, I think for me, it's that collaboration and being strong as a region when we're going after grants or trying to, or post policy.
It makes a lot of sense. It's actually a great idea. For a lot of people who don't know, public policy is actually part of our vision statement. Yeah. One of the ways that we want to benefit the residents of the Coachella Valley. Tell me, during your 3 years on the board so far, what are you most proud of?
That's a really good question, Will. When I was going to run, someone told me like, this board is not really exciting. This is not going to be like an exciting opportunity. Like it's less sexier than what you might be thinking it is. The moment I didn't know like how to process that comment, and then I realized like that's not what I'm seeking. Either way, I mentioned I had served on other boards, commissions, but I had not been elected to a position. And so that in itself, it's not, you take it very seriously. And I think because of my personality or how I try to like portray myself, like really fun, like it's okay, we're chill. I thought, well, maybe this person did think that I'm just looking for the next like great opportunity to like, I don't know what this person was thinking. But for me, like I take it very seriously. And there has been fun. I've had fun because I always like having fun. Whatever I do, I enjoy it. Um, and you have no idea how many like nights or days I'll be thinking, I'm like, we should do this, we should do that. Like just like the vision and knowing that I did not have this opportunity. I wasn't there 3 years ago. And now it's like it just expanded like my vision, my mind, and like this is what we can do, right, as a healthcare district. And so it's been a very exciting. It has been stressful, but in a good way. Nothing that one can't handle. One of the most, I would say, serious conversations was the lease negotiation of the hospital. So I think that was something that I was looking forward to. I stand right by my vote, and I respect the rest of like the votes on the board, just like any other item. But there has been, I'm proud of a lot of things. I do want to commend the job that the district did even before I was elected within like COVID. I think for me, I'm seeing from the outside what the district was working on and how we were supporting the community during those like hard times of our lives. I think that, and then fast forwarding, right, me running, it was like, hey, like they're doing really good things. And I do see ourselves continuing that work. And so I'm just really proud of like the whole staff and the direction that they take and the recommendations. One of the things that I've always said, we do want, we know that staff is there and we trust them. I trust them. And we're experts. You guys are experts in what you do within the district. And so I come into our board meetings wanting to hear from staff, wanting to know where they stand on things. I'm there with my mind, with an open mind, trying to learn from staff, trying to learn as well from their perspectives. And, if there's a change in like, how I look at things, like I welcome that because I think that only makes us stronger, right? As me as a board member. And then if I'm able to share that with the rest of like the directors, but there's been so many things so that I'm proud of. So
Yes.
yeah, it's not just one specifically, but a lot of the things are just the work that we're doing.
Yeah. Thank you for that because COVID was a very impactful time. As a healthcare district, we didn't stop at all. We couldn't stop. The community needed us. And I will say during your time on the board, it feels like it's a very historic time for the district. On December 2025, we turned 77 years old. And I feel like we're on the precipice of a major shift in how we bring healthcare or improve access to healthcare throughout the valley because of the lease purchase agreement that voters approved last November. It's a really exciting time. Would you agree?
Absolutely.
Yeah.
It really is. Um, Especially as we're working on a strategic plan, I see that as an opportunity. And I think this is something that I mention often. It's an opportunity. Of course, we want to focus in the next 5 years, but it's also going to serve as a platform of the future, especially being, so young. Like you mentioned, the district 77 years old, and it's been 6, maybe 8 years since it expanded its service area to cover the whole Coachella Valley. And so, like you mentioned earlier, where the growth is and the need is, I think that we're positioned, um, in like a key, I don't know how to like frame it at the moment. We're positioned to be able to create impact. We are in a position ahead of the future, which sounds weird, right? Because we are. But I think that we're structured in the way that we're working to be able to build something that will just serve to build upon. It's going to be the base. I could see us growing. I know that we don't want to go back into necessarily the hospital business, but just what we're able to do on the ground, if it's, continuing supporting our local nonprofits, educational sectors. I think that if we do this right, we're going to be a key special district in the growth of the Coachella Valley.
Right. I get what you're saying, because this strategic planning process, you really do have to think about the future and what the needs may be then, and actually who's here. So that's really interesting. One of the key components of this process is the community listening sessions that we're planning in February. What would you say to our listeners, to your constituents in Zone 6, to encourage them to actually participate in those listening sessions? Why do they need to be a part of that?
I'm one, right, in this whole zone. I want to be able to hear as much as I connect with constituents and community meetings, or if I'm out at events or family and friends, we want to hear from them. I think it's important that they realize that oftentimes people will say, like, nobody listens to us. We have ideas, but nobody takes us seriously. I think this is the importance. Like, we're inviting the public to come and talk to us. They can come at any time, but we're, designing these specific forums for them. And so I do invite the public. I've been also inviting personally other elected officials, other special districts, because I want us to work together. And I think that's important. I don't want us to do this by ourselves. I think we're stronger if we work together as community, as leaders within the community, as members of public or members of other special districts, other municipalities, and public in general. Also, I think it's very important that we hear from them, especially when I've worked many political campaigns and we go out canvassing, knocking on doors, right? You can't necessarily canvas the whole city, or, we don't have time to do that before February. But
Right.
I mean, I see it the same way. Like, hey, we want to know what's your priority? What are the needs? And we do have those studies, but it's always different when we hear from it. And then also, I think it's important that they understand that we do want to listen to them. So I do invite everyone to come out to these sessions.
Absolutely. And for those of you who are listening and you want to be a part of those sessions, as I mentioned, they're going to be in February. And once we have the locations confirmed, you will find all of the information on our website, which is dhcd.org. So President Barraza, after you were elected president, you wrote a really great statement about that. One of the things that you mentioned that really caught my eyes, you mentioned the importance of prevention. Could you talk a little bit about that?
So, well, for me, prevention is where we get the highest return on investment, both financially and quality of life. I think that if we are good at keeping our families healthy, right, that takes away strain from our healthcare system. So I think for me, that is very important. And we do that already in a lot of different ways, especially through our programs, awarding grants to nonprofits, those that are working in prevention education. So I'm looking forward to, delving even a little bit more within that aspect of our organization.
That's wonderful. Is there anything else that you want our listeners to know about the Desert Healthcare District and Foundation?
Good question. Check us out. Please follow our social media, visit our website, go on our meetings. I promise they're not too long. They're not boring. We're working on great stuff. And don't forget to come on out and participate in our strategic planning process.
Yes, thank you so much for being here. For listeners, you can find out all that President Barraza is talking about at our website, dhcd.org. We're also on Facebook and Instagram. And if you want to check out more episodes like this, please follow us on healthydesert.healthyu.com. And the podcast is available on Spotify, Apple Music, Audible, YouTube, wherever you get your podcasts. Thank you, President Barraza.
Thank you, Will. Have a good one.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydeserthealthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.